Hi there, Mark Jabin here, Medical Director for Haywood County Health Department. Let's talk about where we are now with respiratory viral illnesses. So vaccine recommendations have been much in the news and not without some mixed messaging. So here's what we know right now. So first, flu vaccines. They are available and there is not much flu around quite yet. The best time to get this vaccine is mid-October and on, so it lasts well through the entire flu season, which is usually November through March. Everyone is eligible 6 months and older. Over 65 should get the high dose version. And flu vaccines reduce the chance of getting sick enough to need to see a doctor by 30 to 60%. Next up is RSV. The recommended coverage is during the fall for infants less than 8 months and children 8 to 19 months with a risk factor. And there are two choices. If mom has gotten vaccinated during weeks 32 to 36 of pregnancy, the infant will be covered. And if not, there is a monoclonal antibody treatment the child can receive. Not a vaccine, and it provides good prevention. RSV vaccine also recommended for adults over 75 and those 50 to 74 with a risk factor, and so far it proves to be a one-time dose in this age range. And finally, COVID, and here has been the mixed messaging. And here's what's currently recommended, but this would change if or when the CDC director signs off on the recent ACIP recommendations. Until then, the current recommendation is all children 6 to 23 months, children aged 2 to 17 with a risk factor, all pregnant women at any point during their pregnancy, adults over 65, and anyone 17 to 64 with a high-risk health condition. And the list of these conditions is extensive, and about 75% of people in the U.S. will have a condition on that list. And if so, the only requirement is that the person self-attests to the condition. No one has to check up on it. So see the list here. If you're in this group, no prescription is necessary in North Carolina, as there is a standing order in place from North Carolina Department of Health and Human Services that covers health professionals, that is doctors, nurses, PAs, pharmacists, to give one of the COVID vaccines. And pharmacists can also see this on the Board of Pharmacy website. So if you don't meet any of these categories, such as a person 18 to 64 without one of the health conditions on the list, who, for instance, spends time with someone who is at high risk and you want to get vaccinated to protect them, you can still get access. This is called an off-label use, and your doctor can provide you a prescription for that. Health insurance companies have indicated they will cover the cost of all these vaccines at least through 2026. Medicare will cover the cost as well. And in North Carolina, Medicaid has to wait for the CDC director to sign off on those ACIP recommendations. Also in North Carolina, the VFC, Vaccine for Children Fund, does not have the funds to cover for this year. The health department will have COVID vaccines and plans to make these available once on hand and has funds to cover those who are uninsured as long as supplies last. Now, once the CDC director signs off, and as long as there are no changes to those recent ACIP recommendations, everyone at all ages older than 6 months will then be eligible. No prescription needed. The only requirement being this is made in consultation with a healthcare professional, doctor, nurse, PA, or pharmacist, what's called shared decision making. So stay tuned for that. Now, I know this is a lot, and I know it's a bit confusing. If you're still unclear, call your pharmacy or the health department and explain your situation. They can help you clarify what's available for you. So hang in there, be well, and be careful, especially right now.